Olivia, thank you for joining us for another GCS Lab podcast. So the reason we've invited the lovely Olivia to our podcast today is you've been working in the German industry now for a couple of years and launched your own company as a law firm in Germany. And obviously quite a lot's changed and evolved over the last couple of years, just I guess in really like 5 years overall. And we wanted to delve a bit deeper into some of the topics that we covered together a few weeks ago when we last spoke. And particularly, I thought it was a lot of interesting work that you've done and topics that we kind of dug into a little bit with regards to like the cannabis clubs and all the wonderful people you support through that kind of structure that you have over in Germany. So, Olivia, I wonder if maybe you want to do a quick introduction to you, who you are, your services, all the hard work you do, and then maybe we can do a bit more of a dive into the clubs, cannabis in Germany, and yeah, a couple of other topics that we mentioned as well that could be interesting for everyone. But thank you for coming on, Olivia, and
thank you for having me. Thank you for the invitation and introduction. Yes, I'm a German cannabis lawyer. I advise cannabis clubs and cannabis businesses that want to navigate the German market in regard of regulation, compliance strategy, criminal defense. And I basically help clients, for example, when it comes to cannabis clubs, with the licensing procedure, with forming an association, and when it comes to the medical side, I consult telemedicine companies, for example, in regard of the regulation that they have to follow, and a lot of other businesses. Everything has to do something with cannabis, and if it's about cannabis regulation, I'm happy to support.
And it is quite a complex industry, and there's a bunch of different angles that are kind of being explored in the German industry. And I think you've got kind of a system, regulatorily speaking, that a lot of people are quite jealous of. I think Australia, I know that they would love to have some cannabis clubs locally from like a patient perspective, and particularly in the UK, there's a lot of patients that really just want to be able to have their own independent sources of cannabis as opposed to having to go through the medical systems all the time. So if you wouldn't mind, Olivia, would you be able to give everyone a little overview of kind of the structures for accessing cannabis in Germany at the moment, and then where the cannabis clubs fit in the overall infrastructure for cannabis that's been kind of developed over the last few years, through some of the government changes?
In Germany, we have medical cannabis since 2017, and then we had a cannabis reform taking place in 2024. And it's basically a two-pillar system. So that means we have recreational and we have medical. In the recreational space, we have the cannabis clubs. So cannabis can be sourced recreationally over cannabis clubs. They are non-profit association, cultivation associations. So that means they have to cultivate the cannabis within the club themselves and then give it to their members for a membership fee. The clubs can hold up to 500 members, and each member can collect up to 50 grams of cannabis, that means flower or hash, per person per month. This is the one pillar. The other pillar is medical. So with medical, like I said, we already had medical before, but the medical market was opened after the reform. So the bureaucracy was lowered, and it was or is now very easy to get a prescription. Most of the time, I would say it is done over telemedicine companies. Since 2024, we have a lot of telemedicine companies now in Germany. Usually, as a patient, if you don't have a prescribing doctor close to you, if you don't know a prescribing doctor, because still medical cannabis is stigmatized, telemedicine companies are actually offering a source or an opportunity on how to source medical cannabis, even though they also come with, some downsides. So as a patient, you can go on that platform, you fill out an online questionnaire, and then the questionnaire or the answers are sent to a doctor. The doctor prescribes the cannabis. It will be sent to a pharmacy, and then you will receive your cannabis most likely via mail order, like within 1 or 2 days. In bigger cities, even 1 or 2 hours. Yes, it can be done very quickly.
Oh.
Yes, very fast.
Very German and efficient, yeah.
Yes, has been criticized a lot, of course.
I guess.
Yes, these are I would say, 2 main sources, but of course, patients don't necessarily need to use telemedicine clinics. Like they can also definitely go also to a local doctor, for example, and get their cannabis prescribed there.
That's quite a revolutionary model if you spoke to anyone in the UK at the moment. I know a lot of doctors would be super anxious about that, but also I think they would understand as well, because they do deal with a lot of people in general who are kind of on that borderline of being a patient and would maybe self-define as a patient, but then maybe couldn't get the medical recognition or hadn't gone through like the diagnostic steps of medicine. How do you find, and what do you see in those sort of like interactions? Is it quite loose with patients and members of the public being able to decide which route they go down, or is there kind of like a strict set of criteria for accessing the telemedicine versus kind of like the recreational clubs? How strict is that? How controlled is that? And how much like choice and autonomy did the patients get, the Germans get with their health decisions?
Well, I would say it's quite loose right now. That is a part of the problem, actually, because after 2024, we saw like a huge increase in patient numbers. And of course, when it comes to this telemedicine platform, one thing worth noting is that these are all private prescriptions. So private treatments, it's only if you pay for the treatment for yourself. It's not reimbursed by health insurance, but by public health insurance, and therefore, it has a downside as well. But let me get into more details. So, like I said, accessing the telemedicine sector is very easy because you're only filling out an online questionnaire, and because you're self-paying and it's a private treatment that you're receiving, there are also not a lot of hurdles in regard of for example, how this treatment has to be made. If you would have a video consultation and you want reimbursement from public health insurance, for example, if you want a prescription, it would be necessary to at least have a video consultation. And then there are also certain provisions on how this video consultation would have to take place in order to assure quality, etc., and a proper treatment for the patient. So for private payers, that is not for public health insurance payers, that patients that actually need a reimbursement from public health insurance, that is not an option at all. And this then led to a lot of consumers, of course, also being drawn into the medical space, while at the same time in the recreational space, of course, there are cannabis clubs, but it's very difficult to open up a cannabis club, etc. So the hurdles are very high. I mean, we can talk about this later. And there are not a lot of cannabis clubs right now in Germany. We have something over 400 cannabis clubs. For the amount of patients and the numbers of consumers, 400 cannabis clubs, they definitely don't fulfill the supply for the demand. Yes, so there are then, of course, the black market. The black market is always there, but especially when it comes to patients, I would say that it is maybe a little bit less attractive than telemedicine. So the other route would be telemedicine. Now, of course, we also saw some differences then in regard of the products that is offered to the patients, because a lot of telemedicine clinics, as well as producers, etc., would target consumers more than actually patients. So while, the law has now a little bit over 2 years entered into force, and Of course, the legislators saw that this distinction that the government had in mind has not been followed through because of all of the consumers being now in the medical market. So now they are starting to think about some changes when it comes to the MedCanG, so the Medicinal Cannabis Act. Of course, one change would be we already have a draft law, but it's not through yet. One change would be, for example, a mandatory in-person consultation with your doctor, or a mail order ban when it comes to shipping of the flower, which of course would make it a little bit harder to access cannabis, or to have access to cannabis. I don't know if that would really, in the year 2026, assure the quality of the treatment. I think that it is up to the physician to decide if it is mandatory, or if it's necessary to have an in-person consultation. I'm pretty sure that there are several diseases that can be treated with cannabis where an in-person consultation is not necessary at all. So I don't think that that would be the right amendment to the law. But of course, like I said, the legislator, especially here in Germany, will not watch the law being violated as much as it is right now. And therefore, they are thinking on restricting it again. And one thing that already has been restricted now very currently, or changes, is that, for example, when it comes to public health insurance, that there will be no reimbursement anymore for cannabis flower. So that means that all of the patients that rely on cannabis flower, they now have to go to the private sector and also pay for the flower and their treatment for themselves. And this is exactly, I mean, I have been talking about this, I think, since almost the beginning, even before the law entered into force, that these are the things why it is so critical for all of us to actually show some intention and some morals when we navigate this market and the regulation behind it. It's not about the fast-term or the short-term strategy when it comes to building a business also in the medical sector, and then just high revenues, drawing a lot of consumers, etc., into the market. But in the end, then we will face restrictions that are so severe that it almost, comes to the cannabis legalization in general, especially if then, for example, patient groups have to suffer for this. Yes, just because the top percent of this market want to want their revenue to be as high as possible for a very short period of time. I mean, we're talking about something over 2 years, and this are restrictive measures that are really affecting the market as a whole. So yes, this is where we are right now.
It is nice, though, I think, that you've got almost like a backup option in the form of the cannabis clubs. But I know that, I mean, and this is another question that I wanted to ask you around, like, the price differences as well between telemedicine versus the cannabis clubs, and how cost efficient those are for patients. Because I think we're getting onto a bit of the conversation around kind of the quality of care, but then also the fairness in the access. And then are we losing real patients that really need it when we're opening up to like recreational use? And if we're going for growth of the market, we need to make sure that corresponds to quality of care, but then also like the equality of access to those medicines, and making sure that they're not cost prohibitive for those that do need them. And just as a bit of context for anyone watching, I believe the estimates at the moment for the German, please correct me if I'm wrong, Olivia, the estimates are around 700,000 to 900,000 patients overall in Germany that are currently using cannabis medicines. Maybe some of those people use it every month. Maybe they kind of drop in and out and they're a bit inconsistent with their requirement of the prescriptions. And then of that 700,000 to 900,000, about 200,000 to 300,000 were on the insured side of things. So it's quite a large portion of people, then, it seems like, that are losing their funding almost for these medicines if they've been getting the reimbursement. And I think a lot of companies underestimate just how much of an impact that has on their patients when they're paying oftentimes quite a lot of money for that access. So how, given that you speak to kind of both pools of members of the public, the recreational consumers who are maybe pseudo-medical, some of them, and then the strictly medical patients, how do the costs compare? Is it competitive? Are there, obviously there's quite large oversupply issues at the moment, just globally with regards to cannabis, but then, yeah, how are the costs impacting patients' decisions at the moment? And do you know roughly how much the average patient spending on a cannabis prescription?
No, I don't know that one. But I know that in regard of the changes of the law now with the statutory reimbursement not being in effect anymore, like 65,000 patients are actually losing the reimbursement from their health insurance. I think that's crazy. That's a crazy number. 65,000 patients. That's a lot. So that's one thing. Then the other thing is in regard of costs. So when we talk about a cannabis club, there is only a membership fee to be paid. I mean, only, and still it's a membership fee, but it's an administrative fee, and then most of the time you have a price per gram, or sometimes you have to pay, let's say, a fixed amount, a flat fee of, I don't know, 50 euros a month, and then you can get, for example, 20 grams or something like this for that. Yeah. I would say in general, the prices of telemedicine or the prices in the medical sector are very, very competitive to the recreational prices right now. At the beginning, not so much. Of course, when it comes to medical, I think one mistake that's often made is that we compare the gram prices as such. But especially as we just said it, a lot of patients are entering through the telemedicine sector, and it's a private treatment. I think you also have to add the price for the treatment, because this is what then the patient in the end actually has to pay. Yes.
Yeah.
So at the beginning, even though the prices were, I would say, 7, 8, 9 euros per gram, you still had to pay 20, sometimes, I think at the very beginning, even 50 euros for the treatment, etc. And then that changed also with time. But in general, I would say the prices for flower in the telemedicine sector are around 4 euros, 4 or 5 euros, something like this right now. And then the treatment on top, and that is also around, I would say, 29 euros. So yeah, there you go. This is around the price for the patients. And in the recreational space, most of the time you have like a monthly membership fee of 10 euros. And then prices, I would say, are between, that's a little bit difficult to say. In average, maybe 7, 8 euros per gram, something like this. It's difficult to say because the associations are non-profit, like I mentioned at the beginning, and therefore the membership fee is equivalent to the cost that the association has. And of course, that is very different from association to association. There's a difference in where the association is located, and then, of course, just the lease contract when it comes to facility, then the facility itself, because some clubs start with a small facility and relatively cheap equipment. Other clubs start with very high quality professional equipment and facilities, etc. And therefore the prices can be very different. We only have over 400 cannabis clubs right now. So I would say in average, it is what I said, 10 euros per month, and then maybe 7, 8 euros per gram.
Super interesting. I was going to ask you then about some of those facilities as well, Olivia. the facilities, obviously, a lot of the cannabis companies are spending ridiculous amounts of money on setting up the facilities. There's quite a lot of overhead. How do the cannabis club facilities compare to the pharmaceutical cultivation scale facilities? Like, are they, and how are the criteria maybe different or similar as well, or is it just very decentralized, let's say?
It's not comparable at all, because they don't have to follow GCP, GMP compliance guidelines at all. Therefore, they're relatively free in how they set up their facility. Moreover, there are provisions in the law which open up the possibility of further regulation in regard of quality parameters, etc. But basically, none of that has yet been written or is in place. So therefore, the only thing that the clubs have to test or assure in regard of quality is basically just the THC and the CBD content. And yes, this is also why, in my head, when you mentioned that some of the patients could also use the recreational road, that is difficult here in Germany right now. I mean, I know, and I work with the clubs, and some of them have like facilities that are really set up in a professional way. They have a lot of investment in the background, etc. And I'm pretty sure that they are producing a good quality flower, but in the end, it's up to them how they test it, if they test it, apart from the CBD and THC content, etc. And as a patient, that would be, for me, if I rely on good quality cannabis flower, maybe a little bit too loose for now, at least, let's say. When it comes to the costs, I would say most of the cannabis clubs in Germany are struggling quite a lot with that. To explain this a little bit further, so like I said, in principle, the association is non-profit. So therefore, and also, moreover, if you invest anything inside of the association, like let's say I'm a founder of an association and then I invest the equipment, and the equipment is held by the association and owned by the association, then it's everything is owned by the members. It's not mine because I'm the founder, like similar to a company, but it's like basically, yes, it's everything belongs to the members in total. So therefore, it's not recommendable actually to invest as a founder into your association, and then the association buys, for example, the equipment. It is more recommendable as a founder to found also a company next to the association. That company holds the equipment and owns the equipment and then rents it to the association. This is what I would say 99.9% of all of the associations here in Germany do. But it's also a huge problem because of the contract between the company and the association, and these contracts are closely watched by the authorities, because they say, which I think is actually not done correctly, but they say that because of the association and that it has to be non-profit, etc., the founders of the association, even if they're earning money through the company and through the rent agreement, they make it profitable through the back door, which is not true. Just from a legal point of view, it's not true, because there are two different kind of entities, yeah? So this is one problem, and because we have this kind of structure and because we have this kind of hurdles, one problem that a lot of founders or clubs are facing is, of course, investment. Yes, it's a lack of cash flow in the recreational market, more than in the cannabis industry in general, especially here in the recreational market. So, of course, this leads then to less professionalism in regard of, experts that you can pay, in regard of facility quality, etc. Yeah, if you only allowed to and you're also not getting bank loans or anything like that at the beginning. That's, I think, very normal in new opening market when it comes to cannabis. Yeah, so banks will not grant you any loans, at least from now, and especially not in the recreational space. Maybe in the medical space that's different. So they would rely on investment, but then there is almost no security if you actually will have a license. Then through the licensing procedure, you have all of these fixed costs while you don't know when and if you're going to receive a license. And then also at the same time, you have to fight and argue with the authorities about, let's say, for example, the rent and what is allowed and what is still allowed, or what is seen as a workaround to the non-profit regulation and stuff like this. So to sum this up, the effect is, unfortunately, in the recreational space that we see a lot of small-scale facilities that probably could use some improvement. I think that investments here from the founders start at 100,000 and go up to 250, maybe 300,000. And then later on, of course, when they actually had the possibility to have some members, because they also have to do all of those investments without members yet, yeah, because they don't have their license yet. So once they actually were able to receive some members and once they have some cash flow, they start with phase 2, and then they are like reinvesting into their facilities and into their structures. I think it's let's say from the authority point of view, because it's a federal law, but the competent authorities here on the state level, and within the states, we have very different opinions when it comes to the cannabis legalization, and a lot of states are very critical of that. So all of what they see is still with their prohibitionist mindset, that they want to make it as difficult and unattractive as possible to open up a cannabis club. And unfortunately, this then has the effect not only of a lot of licenses not being granted, but also people or founders being bankrupt along the way because of everything that they're doing. Yes, and the long procedures. Sometimes it takes 6 months. Sometimes it takes 2 years to receive a license from the authority. Yeah? Long waiting times, very long waiting times, completely understaffed. And then also in regard of quality, yes, because if you want to assure quality, you also need to have, yes, the experts, the quality material, the quality facility, etc. This is all part of it. But because they see non-profit as no one is allowed to earn money, no one is allowed to invest here, yes, they kind of don't understand that in order to produce a good quality product, and it's not just that for having a better high or something like this, yes, which I think is in their mind, like why would they produce a good quality product so their high is better or something like that. Yeah, that's probably their stigmatizing brain. But in the end, it's about safety, yes, it's about health and quality control and all of this kind of things. They don't care enough, unfortunately.
How did the police factor into all of this as well, Olivia? Like, what's the reaction been like from the police? Obviously, if the councils and the local governments are skeptical, are there still issues with policing that you see? Or because we're in a bit of a transition period at the moment in the UK where the law's changed, but the police maybe don't always know. And so the patients sometimes get treated like a criminal, even though they've got the prescription. They end up going to court and then they go, oh, sorry, now we understand that's our mistake, and you start again. But I've already been arrested, gone to prison, or gone to jail for 24 hours, been held in a cell. So are there similar kind of issues over in Germany that you're seeing? And how overall have the police reacted to the pivot to having recreational, kind of almost decentralized cannabis access? Do they still treat it like the black market? Are they treated fairly as well, would you say? Yeah. How's all that looking for the Germans at the moment?
Yeah, I love that question. I think that question is not being asked enough. A very good question. So I'm a criminal defense lawyer, like I said. So I'm not only defending like CEOs of companies, etc., but I'm actually also defending patients and consumers. And one thing that always gets to me is while, for example, when I'm at conferences and we're talking about all of this big scale projects, GMP, GACP, compliance, I don't know, advertisement and all of this kind of stuff, we sometimes completely forget a simple thing like, let's not only educate doctors, maybe let's also educate the police. Because that is very necessary, because we will not have customers, patients, consumers, whatever it might be, if they have to fear the police, yes? And
great point as well, Olivia.
yes, and a lot of, I think maybe there is not a lot of awareness about this, because how would it be if you have never been in contact with it? So this is why I'm talking about this. This is why I love this question. Like you said, most of the time when it comes to new regulation, the police actually is not aware of the regulation. This is one thing. I think in Germany by now, with this over 2 years, they understood. Yeah, we have reached this point. But unfortunately, just because they understood doesn't mean that they're actually willing to follow, yes, that they are agree. And it is very important that internally they also agree. This might be a little bit different depending on where you are in Germany, because of course the north is a little bit more liberal than the south. But in general, and I'm from the south, so that means like I'm dealing with this very conservative mindset, also in regard of the criminal procedures and the state authorities there. And when I look at my trials and when I look at the cases that come up, it is very different to our reality in our little cannabis bubble, what is going on outside. I mean, cannabis has been decriminalized. That is one thing. So that means even as a recreational user, you're allowed to carry up to 25 grams of cannabis in public. Now, the problem is, of course, that for recreational consumers as well as patients, for example, when you are out and about and now you think because of the cannabis legalization that has been talked over about everywhere, and you think, oh, I'm now allowed to smoke a joint, I'm now allowed to do this, and you meet a police officer and they ask you, let's say in traffic, and they ask you, have you consumed alcohol or have you done any drugs, blah, blah, blah. And most of them are like, yes, I am a patient, though. I have smoked cannabis yesterday, but I'm a patient. Here, I have my prescription in my car. And then the police officer says, perfect, please get out of the vehicle. We will have now a test. And then they find themselves in criminal procedure, not only about like a misdemeanor, like an administrative offense, because they have been maybe over the, limits of the THC in your blood, etc., which could lead to a criminal defense if you're a recreational user, nothing if you're a patient, but it also always depends on how you're consuming this. No one knows that, yes, that you actually have to use a vaporizer, for example. You're not allowed to smoke a joint.
Can't smoke it.
Yeah. So if they ask you, how did you smoke it? And you're like, oh, I smoked a spliff, like most of the Germans do. Then you're like, okay, it doesn't matter if you're a patient. It doesn't matter. You're not allowed to do this. Then I had one client, for example, he was in traffic and he was driving a little bit too fast. I mean, we are talking about one red light and 20 kilometers per hour too fast in the city, which of course it's a lot. Yeah. It shouldn't be, but
bad.
It happened. So unfortunately, at the beginning of the when the police stopped him, he said he's a cannabis patient. Unfortunately, because he didn't even smoke. Yes, he smoked the day before.
Right.
And they made it a criminal defense because they said that the violation in regard of the traffic light and the speed limit, etc., that he did this because he was high. And this is what, and then he lost his driving license, he was convicted, he was sentenced, so fine, etc. All of this, and this happens, I would say, almost like not every day, but every other day I have someone calling that lost his license, patient or non-patient, because of this, for example, like their driving license, which is crucial to have your driving license. So it's very stigmatizing. And yes, a lot of criminal procedures. When then I'm handling the police within these cases, we have a witness interrogation, I'm asking them questions, etc., building up the pressure, all of that. And then when the police officer starts to talk about drugs, we are talking only about cannabis, yes, and in front of him is actually a defendant that is a patient. He's like, yes, if he's consuming drugs, blah, 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 like this, yes, as if he would be on heroin.
Yeah.
You already know that they're not there yet. So we need to open up the conversation, and we kind of need to build a bridge also to them, unfortunately, to bring them in, because otherwise we can't save the patients and we can't save the consumers. Oh, and one further note. In regard of telemedicine, one negative change that happened here in this field as well. At the beginning, if you were a patient and you had a prescription, this at least was something, yes? You had evidence that you were a patient. Now with telemedicine and with the prescriptions being handed over like, bread from the bakery, basically it doesn't count anything anymore, yes? So if you're having a prescription and you bring it up in a case, most of the time they will have like an expert witness as well, which you have to pay in the end if you're convicted. And this expert witness, the way how they interrogate this defendants is like, I mean, so inhumane, and it has, it just shows one major mistake that the whole industry is doing with the way how they set up the system and how it's done now, because this is exactly what we were talking about when we said, okay, if we make everyone a patient, then patients will be stigmatized and it will be very difficult in regard of their reputation, etc. And this is exactly what is happening right now.
I've got a million notes here, Olivia, about, because this could also be a whole podcast in itself, just talking about like driving and cannabis, for example.
Yes.
There's so many parameters there around, well, if you say it this way versus if you say it that way, or how you kind of present your answer the questions that the police ask you. That's kind of like one thing I always find interesting. Well, if you respond this way, you end up going down one pathway, and well, if you say it like that, or there's so many nuances to the legal interaction between a patient or member of the public and a policeman or law enforcement that I don't think enough people are aware of, to be honest, with not just cannabis, but just in general.
Yeah.
Like if you're speeding, are you aware of how quick you were going?
Yeah.
I was doing the speed limit. So I totally sympathize, because we've got the exact same issue here. And I know, again, it's difficult to say what blood THC level corresponds to intoxicated versus sober. The UK's got like this zero tolerance policy, unless you've got a prescription, and then you can argue it. But there's so many patients that are getting caught in this.
Mm-hmm.
I guess it's like a day-to-day practical issue of, I'm a member of the public, I need to drive to and from work or to school to pick up the kids or something. And if you're caught at the bad time, or you get the wrong police officer, or there's an angry member of the public that reports you and they get the wrong perspective, or they maybe don't understand cannabis as well. So I guess I'm finding it interesting hearing how, although the government can make a law change over here, and now you've got a medical prescribing issue, there's still then all of these like legal issues for patients on the other side as like a bit of a cascade. What I wanted to ask you a little bit more around is kind of like the criminal defense side of things. And do you find that there's lots of patients with medical prescriptions that are getting caught in these kind of I don't know what they'd be called, like policing inefficiencies, or these kind of maybe it's a policy inefficiency where, although they're following the law, it may be seen, or maybe because of the stigma associated with cannabis, the history of it being quite strictly governed. Like, what frameworks are there? What kind of guidance is in place? Do the telemedicine clinics inform patients of this beforehand, or is it something that patients just find out accidentally at the end once they're having once they have like a police interaction? Or again, same for like recreational users. Are there any key templates or bits of information that the government gives out, or that some of the telemedicine clinics have to give out, or is it still just a bit of a free for all? Good luck, here's your cannabis.
Yeah, that's something. Yeah, good luck, here's your cannabis. So the government definitely doesn't inform about that, that's for sure.
Okay.
They will never share their own tricks. But I would say that in the recreational space, consumers are, of course, relatively aware, because they most likely have been consumers also before the cannabis legalization, so they know that police is not your friend most of the time, yeah? When it comes to patients, unfortunately, or consumers that become patients and are thinking that they're therefore then privileged, unfortunately, especially with the new developments of, like I said, prescriptions not being seen as right, or not being seen as rightfully prescribed, let's say it like this. I think that a lot of patients / consumers are not aware of that. And there are some telemedicine companies I know that are already informing patients about this. They're also holding webinars, etc., in that regard, which I think is a really good thing. But like in every market, there are some that do it the right way, that are concerned and aware, and some are not. Unfortunately, I would say not a lot of telemedicine companies are taking that into consideration for now.
I think we've got a similar issue here for the most part. Although there's maybe some general information on the websites, the actual support afterwards of like, well, you've given me this prescription, the police are interested in me, is someone going to help me out? Oftentimes, no. But there are a few clinics now that have opened up like a legal support service, which is nice. It's the least we could do, I think, which is kind of nice to see.
Yeah, that would be, yeah.
I was going to ask you, Olivia, we've got another issue here, and there's probably two more final issues to run by you. The first is hospitals. How do hospitals interact with patients that are using cannabis medicines at the moment? So one problem, for example, from the UK as an example, is patients with like vaporizers. They have to go into hospital. Maybe they've had a flare up from their condition, they've had a seizure, and they've had to go into hospital, and they're in a hospital bed. But the hospitals and the doctors and staff in there are terrified about them using their vaporizer or their cannabis products. They don't like the smell. And that's generated a lot of challenges for, obviously, patients are going to use hospitals. They have diseases and conditions that they need treating. Have you seen any instances of that in Germany where, yeah, patients feel as though they're being kind of treated badly or stigmatized because of their cannabis prescriptions at hospitals?
Good question. I think that I cannot give a general answer to that. I know from personal experience that in most hospitals it's prohibited. But I can't even say most, because it's a personal experience, like a couple that I've seen so far. I would say, though, in general, that this is one of the difficulties that we're facing in Germany when it comes about the consumption of cannabis, because when it comes to the consumption of cannabis, because in Germany we opened up the market with, like I said, these two pillars, recreational and medical. So before, there were only a few that already had a prescription and were consuming cannabis in relation to the size of the country, etc., that were consuming medical cannabis in public, etc. So I think that now with more and more cannabis being consumed outside, people cannot really differentiate, and I think a lot of people don't expect that someone that is consuming cannabis could be a patient consuming their prescription, yes, their medical product. So I think that is a problem that we're facing everywhere. It doesn't matter if it's a hospital. I know, for example, in courts that it is also absolutely prohibited. And I mean, we're not even talking about inside. Yes, we're talking about outside smoking, etc. So it's absolutely prohibited everywhere in every court that I've ever been to. And I think that this counts then for all of the authorities, and therefore I can imagine also for a lot of hospitals. Yes, it's just an ongoing problem that dealing with recreational and medical market being open at the same time, and therefore there was no period of adjustment where the society actually could adjust to the thought that people are consuming medical cannabis for the treatment of their diseases.
Yeah, they must be crazy using cannabis for their medical treatments, or they're making it up. Is some interesting ones too. I guess next question, similar kind of issue, is this kind of like public consumption challenge. So another thing that's opened up here is a lot of times the patients are on some kind of like social housing, or they rent their house, or maybe they've got neighbors as well. And the smell, maybe then the local government asks questions, the landlord of the house who owns the apartment, or the building manager also then asks questions. Do you find that there's many disputes in that sense as well that patients are kind of experiencing around, well, I live at home, I have a prescription, I need to use this? Do you see that being a kind of a bit of a, I don't know if that's like an injustice or like a bit of social equity in a way, or a bit of a social issue, but yeah, have you noticed much of that being an issue? Because it sounds as though the consumption of cannabis being quite odorful and smelling quite strongly in some cases.
I have to say, especially as I'm from Munich, and like I said, Munich is very conservative. Yes, it's the capital of Bavaria. So that I feel, well, the Germans love rules, and the Germans love to comply with rules. And I think in the situation when the legislator and the government decided to legalize something, that the Germans then are like, okay, this person is actually allowed to do that. I cannot say anything against it. I cannot prohibit it. Yes, there might be some assumptions, like if someone is really a patient, or for example, I've noticed this in my practice with a lot of home growers that had after the legalization, you're allowed to have up to 3 plants per person for home grow purposes. And whenever they had this on the balcony, and of course the smell, etc., is a little bit more than if you're only smoking it. I have a lot of criminal procedures because of that, because the police, I mean, it's not the fault of the police, but the prosecution would actually apply for search warrants, and they would go through, and this apartments would be searched, even though it was allowed to cultivate 3 cannabis plants, because they just said, okay, we have to check, maybe there is further drugs, etc., blah, blah, blah. And then if the owners of those plants actually had maybe a little bit more at home than the 50 grams per person are allowed, then you already have a procedure. Yes, so that was unfortunate, and then you can also not really challenge the search warrant, at least not in Bavaria, even if it was unlawful, because then they will always say in court, well, we found something, you know. So that is difficult in practice. But in regard of smoking, for example, in Munich, we have the English Garden. Yes, it's a very public park and space. And of course, because the government here in Bavaria is very, very conservative and against cannabis, the first thing that they did is they made like a consumption ban in this park. Yes, it doesn't matter if you're a patient or not. Yes, just a consumption ban. They generalized it. And this was then challenged in front of court, and the courts actually made a decision that they are not allowed to have a consumption ban like this, because it's a federal law, and in the federal law there are written provisions where to consume and where not to consume, and you cannot just as a state authority further provisions according to your liking. So at least, and this is of course also a higher regional court of here in Munich, so it was a Bavarian court as well. That shows me though that there is some rethinking, at least when it comes to the consumption part, yes, that they are allowing more and more consumption to happen in public places. I remember when at the beginning of the legalization, on the street next to a restaurant, if you would smoke a joint there, the restaurant owners would come out like, not here, you're not allowed to do this. Now, when you're walking through the city of Munich or whatever city you want to walk through in Germany, you smell it everywhere, left and right, basically. So I would say that there is, we also see some positive changes when it comes to the cannabis legalization, of course, because we have more and more consumers. We have a lot of, through all of the demographic layers of the society, we have a lot of consumers that are trying it for the first time, new, rising patient numbers, and of course, therefore also really good experiences. I think that the society in Germany, first of all, is convinced if it's officially legal, that happened, and then second, the change of the mind of the society doesn't happen just because a regulator or the police or whoever understands the potential of cannabis, but because they're actually trying, or they know someone that tried. In the end, after all, it helps, yes? In the end, cannabis has high value, yes? We have not even discovered it fully yet. So therefore, it just spreads everywhere in the society, and we can see some changes there, positive ones.
Super interesting how everything all sort of like ties together in Germany compared to the UK, because again, this is probably one of my closing questions for you, Olivia. How much of a positive or negative impact do you think the decriminalisation aspect to the law change, how much of an effect do you think that's had on the telemedicine side? Like, do you think the telemedicine would have had the growth and success that it did without the decriminalisation aspect of the law? Do you think it was a good thing? Do you think it was positive, had a positive impact? Because the reason I'm asking is like, we don't have that at all in the UK, and we've still got all the problems, and we've got a small medical market that has lots of issues already. Can you imagine a scenario where that didn't happen in Germany? Do you think that would be, you don't wish that it wasn't decriminalized?
I'm a criminal defense lawyer. I definitely.
Good business.
I will always be for decriminalization of all drugs. So for me, let me start with this. When it comes to decriminalization, it's actually not a question of markets or not markets. If consumers are sourcing it from illegal sources or not, that is absolutely not relevant for the question of decriminalization. The question of decriminalization is a different one. It's about my right as a human to consume whatever I please to consume, yes, and as much as I want to. This is my body, and I decide what I want to consume, what I want to put into the body, what I want to do with my body. This is my right. And I think it's the It's so absurd that the state has the audacity to criminalize me for my own consumption. And then they do it to the back door and say, oh, we're not criminalizing consumption, we're criminalizing possession. Well,
same thing. Yeah.
the same thing. It's the same thing. Like, don't play stupid. It's the same thing. So for me, decriminalization is an absolute necessity, because you cannot criminalize people for what they want to consume, how they want to harm, if you look at it from a prohibitionist mind, or how they want to actually take care of their body, if you look at it from a pro-cannabis mind.
Yeah.
So that is one thing. Then on the other hand, of course, the problem in the German market when it comes to the decriminalization is, though, that the legislator had in mind, the policymaker, that on the one hand, you have the recreational space and you have the cannabis clubs, and the recreational consumers would source the cannabis through the cannabis clubs. But because on the state level, the authorities are not understanding that if they don't grant cannabis clubs the licenses, that there are only two other pathways, which is illicit or telemedicine, yeah? So thankfully, actually, that we have telemedicine in that regard, because otherwise the only other option would be illicit, yes?
Yeah.
And this is one thing that I always bring up in all of my procedures in the recreational space in front of the authorities, when they're arguing and when they're interpreting the law in such a restrictive and conservative way, completely unlawful, has nothing to do with law sometimes. But I'm always arguing, like, what is your intention behind this? What is your intention? Because you're restricting the access of the recreational space for legal recreational cannabis. For who? For who? Because it's not that the consumers will not consume because there is no supply. Consumers consume since centuries. This is why we actually have cannabis legalization, because the policymaker understood that we need to change something because the consumers will continue to consume. So let's offer them a regulated, controlled, good quality product, so they will not harm themselves. Let us support this, yes, because they want to consume. So we will actually, as a state, supervise it and take care of it. So that there is harm reduction, that we actually have measures in place for youth protection. Yes, this is also one thing. Telemedicine and the patient, this is for adults. Yes, so you are over 18. Of course, cannabis consumption in the recreational space under 18 is prohibited. But let's be honest, like, definitely. The youth is drawn to it. So the problem is that in the recreational space, we actually need some protection measures, because what happens now is that one 18-year-old gets, 100 grams of cannabis of maybe every telemedicine company. I mean, there is no supervision in place for that. And then they give it to their 17, 16-year-old friends, yes? If we would have a recreational space, if we would have the cannabis clubs as they were seen from the policymakers, there would be some youth protection concepts, yes? There would be some regulation and compliance measurements for this in place. But because there are no cannabis clubs, or almost no cannabis clubs, there's absolutely no youth protection right now, yeah? So this is one thing that I really don't understand, and that I would definitely change. Like, definitely the policymakers and the state authorities, it is so urgent that they rethink the whole recreational space. They really need to take off the prohibition glasses in that regard. It is time, because I see a lot of adolescents, and I see a lot of minors consuming cannabis, and it is not looked at, and it is completely overlooked. And this is one of the dangers that the opposition of the Cannabis Act actually always brought up and said, oh, our youth, and this is so risky for their health. This is that. But now, once it's in place, everyone is just looking away, and in the end, even blaming the cannabis industry, even though they couldn't do anything, because it's not the it's not the task of telemedicine or a medical company to have youth protection measures in place. Yes, they are targeting patients, actually. So this is the task of the recreational space and also the state authorities. But they neglect that. They just want to prohibit. So unfortunately, if you don't want to source your cannabis over telemedicine because of maybe you don't want to be a patient and or you just don't like the product on there, whatever the reason might be, the only other option is the illicit market still. Yes, I mean the cannabis clubs that are there, like the 400, yes, but other than that, it's the illicit market basically. So I tend to be a little bit hesitant when I bring this part of the conversation up, because I know that the policymakers and the government, especially the one that we have in place right now, will take this and turn this around as, oh, the Cannabis Act didn't work. We have to withdraw the law. We have to, even though they never, when it comes to the recreational space, they never actually gave it a chance. You cannot say that something didn't work that never entered into force practically. Yes, that you didn't force the state authorities to actually do what they're supposed to do.
Yeah.
Telling us that it's not working because of cannabis. No, that's not the reason. That's not the reason. So yeah.
You want it not to work is one.
Yeah. And then you're blaming it on the industry.
Yeah. Oh, look, it doesn't work. It's broken.
Yes.
Thank you, Olivia. You've got me thinking more. What you're saying resonated with me a lot about the autonomy, kind of like the rights as well that patients have and citizens have. I don't think, and I think there's like an English attitude. Not enough people think that, oh, actually, who are you to tell me what I can put in my body? Or if I want to drink 100 beers, I'm going to drink 100 beers. Like, I don't need I don't need, and I might, but I don't need like laws or kind of governance over any of that. And there's only one other kind of lawyer that I've spoken to, also in criminal defense, that mentioned a similar kind of topic of cognitive liberty and kind of like, hey, this is my mind. I can decide what I do with my mind, as long as I'm not impacting you. And like, where's the crime? So I think a lot of people, UK viewers, will be quite shocked to hear like, what? They're allowed to do what they want. They can just go and get cannabis if they want to try cannabis. That would blow people's minds here. They could think, I don't think they would believe that Germany is a functioning society anymore if they heard some of this podcast. So thank you for giving us such a nice walkthrough of how the two pillars work together, some of the nuances of what that means for patients and their experience as well. And I think we'll have many more conversations, Olivia, around current events and how all of this kind of transpires over the next few years as well. Question for you, Olivia. Would you like to tell everyone about your company again briefly, where they can find you on LinkedIn? I'll put all of your details below so everyone that's watching can come and find you. But is there anything you'd like to let people know about? Are there any events that you're going to be attending where people can come meet you, Olivia? Like, tell people where they can find you and what you can do.
I mean, you can always find me over my website, of course. I will not mention the names if you put the details in there anyways. I have Instagram and LinkedIn, etc. So if support is needed, just reach out. There's no high hurdles for that. You can even book an appointment over the website, no problem. And in regard of events, I would say in Germany, I'm at all of the bigger conferences, ICBC, Mary Jane, Canna Fair, HemCan. Regularly a speaker there at these conferences. And for the bigger ones, I have not decided yet, but I'm looking at Asia for what? Let's see.
I know there's a lot of nice ones in Thailand at the moment, but
yes, I've been last in Bangkok. I was also speaking there, and in Tokyo, I was also speaking there, and it was amazing, really nice community. I love Thailand. I mean, it's very nice mindset, very great people. So yeah, I'm drawn to that again.
Yeah, no, I also feel the draw to Thailand as well. Thank you so much, Olivia, for taking the time to come and speak to me and do a digest of all of the different elements to the ecosystem, because people, I think it's very easy to go, oh, it's just the cannabis industry, they give out cannabis, but there's a lot of different layers to it, a lot of nuance, and super interesting.
Thank you for
we
having
will get a decriminalized scenario in the UK, I think, at some point, because we talk about it a lot. I think a lot of the politicians they like to think that they're on the side of liberty and decriminalizing drugs, so we don't target people. We're going after the black market and organized crime. But I guess we're still probably quite a long way away from that. But there's potential, I guess. But thank you, Olivia. Thank you, everyone that's been watching, and we'll see you soon for another GCS podcast interview.
Yes, thank you for having me.